Many patients ask, what are the complications from male enhancement procedures? Well, of course, it depends on what male enhancement procedure you're having done. For example, the procedure I perform is a permanent male enhancement procedure that is by injection, right? There's no cutting, no stitches, or anything like that. So we know we've just eliminated all surgical complications right away, right? So not worried about cutting nerves or damaging anything like that, nerves or vessels, whatever. Let's talk about the procedure. Considering it's an injection, what are the potential complications? Well, of course, we have more garden variety common type issues. And I hate to call them complications. That sounds like a too serious of a word to say if you have a little itchiness, that's a really complication. But some patients will have some itchiness, and usually that'll occur by week 2 or 3, because when collagen forms, because remember, let me take a step back, when the filler is placed, let's say in the superficial skin area and so forth of the penile shaft and glans, or scrotum if you do all 3, the filler stimulates your body to make its own natural collagen. Now, usually we see collagen formation increase in rate by the 2nd week and perhaps by the 3rd week. And that could manifest as itchiness, right? It can cause that effect. Now, is that a complication? Well, it's certainly a discomfort of some sort. So that can happen. Other things that can happen is the wrap being too tight in certain areas. So it can cause an abrasion of the skin, right? Maybe we'll have a little cut of the skin or something like that. Now, a cut of the skin is not a big deal, but it's like a paper cut in the wrong place, right? It's a little uncomfortable. So that we handle well. You just put topical antibiotic on that, keep it clean and so forth. But we notice these things happen. Another thing that could happen is, well, if the wrap is too tight and it's on for a prolonged period of time and no one's monitoring it, you can get a small skin sore, right, or a superficial ulceration. Well, those heal very well. However, we want them to, of course, we want to prevent them from forming. However, if they do form, they do heal well if you follow protocol. And the simple protocol is soap and water, topical triple antibiotic, and so forth, and making sure that pressure has been reduced in that area, right? So those are, common things we would see. Another, we'll say, complication is sometimes there's a little asymmetry. Now, symmetry is important in the penile shaft because it's a tubular structure, right? We want to keep it tubular. However, what happens if the wrap is too tight in one area, right? Let's say theoretically, we planned on putting the wrap on too tight in the midsection of the shaft. What do you think would happen? Well, the filler itself is just a gel, right? The gel will move out of position. If it moves out of position, what are we going to get? We're going to get an hourglass-shaped penile shaft, right? No, we don't want that unless you're requesting that. However, how do we prevent asymmetries? Number 1, learn how to put your wrap on correctly. Number 2, be observant or vigilant. We have to make sure we're observing, see if there's any shifts anywhere, right? For example, if there's a little elevation here, I could just do a simple rolling motion to flatten that out, right? It's kind of like Play-Doh in the beginning, so to speak. You can mold it a little bit. If something moves, you could kind of move it into position. But we have to keep our eyes on that, right? So we could remedy asymmetries by observation and also taking action here to kind of move it and flatten it and do whatever we have to do to make it balanced, right? Another complication would be, let's say, a rash, let's say, and that could be due to the chemical sensitivity of the skin, because any kind of material touching the skin, the materials may have some chemicals in it. So you can get a rash of some sort, and sometimes we leave it alone if it doesn't bother you, or we'll put some medication on to take care of that. Now let's talk about things that are not very common. For example, probably 0.1% of patients may get an infection, right? So what do we see? What happens? What manifests in that situation? Well, we get maybe some tenderness, some redness, and so forth. So immediately, we'll provide antibiotics and remedy that situation, okay? So that's the infection situation. It's never really serious. And having a 0.1% or 1 out of 1,000 treatments, having an infection is much better than the general rate of infections with procedures and so forth. But the important point is there's a remedy. Another rare event would be a larger skin ulceration. I see this infrequently. I've seen maybe this is 1 out of every 2,000 procedures. What we see is this occurs in patients who are HIV positive, that have medicines on board that affect the immune system, or patients that have had kidney or liver or other organ transplants that are on immunosuppressive medicines. We recognize that these medications can affect healing capacity. So in the beginning of my practice, we didn't think there was a connection, but when we put the filler in, we realized that when we had our first larger skin ulceration, there was a correlation between that. So subsequently, we would put less filler to decrease the burden of healing in those patients, which resulted in lesser or smaller ulcers to no ulcer formation. Okay? So not to be worried about it, even those who've had pretty large ulcers healed quite well. Right? So we have a remedy for that if that were to occur. But that's a rare instance, right? That occurs, I might have seen maybe 5 or 7 of those in the last 11 years after almost 10,000 procedures. But now we have identified the patients that are at risk, and we know how to handle that at this point. So those are the minor, some of the minor issues that can occur. And some of the major ones. I mentioned the skin ulcer because that really would be a major issue, right? And we also have a very good remedy for it. Again, it doesn't happen often. It's a rare event. However, there is a remedy. And for those in the future that may get something like that, we know how to handle that, and it's not an issue at all.